Welcome to Mental Health First Aid. My name is Trina Lukoff. Today we are joined by Kelly Bryant. She is the Director of Clinical Excellence in Nursing at Linden Oaks Behavioral Health. Thank you, Kelly, for joining us.
Thank you for the opportunity.
You're welcome. Could you tell us a little bit about your role at Linden Oaks?
Sure, I'm the Director of Clinical Excellence in Nursing, so I oversee our quality and performance improvement programs. I also focus on education and training for our staff and a number of other initiatives, including emergency preparedness, infection control, and safety measures in the organization.
Great. We're very lucky to have you, so thank you for joining us. Today our topic of discussion is suicide awareness, and specifically like taking action on suicide prevention in our community. So specifically I want to first focus on what Linden Oaks Behavioral Health is doing to help prevent suicide and keep people aware of what's going on in our communities.
Well, as we know, the suicide rates continue to, increase. We're not making an appreciable dent in reducing them. Across the country, the suicide is the 10th leading cause of death, and here in Illinois, it's actually the 11th leading cause of death. So recognizing this back in 2016, the senior leadership at Linden Oaks really put their heads together and said, we want to play an active role in community awareness and education. So we applied for a grant with the city of Naperville, and we were fortunately awarded a social services grant for 2 consecutive years. So from 2017 to 2019, we provided education along a number of venues. One was gatekeeper training, which was geared towards the community members with a very basic fundamental education and awareness program. And then at that same time, we also enhanced our education and training to the professional members in our community through the professional seminar series that Linden Oaks Behavioral Health offers on a monthly basis. In 2017, we did a training program for the professionals, which was very focused on just that identification and early recognition. In 2018, we brought in a national expert on suicide prevention and awareness who educated not only our community members, but our physician providers within Linden Oaks and many of our own staff. And then most recently in December of 2019, we offered the third part of that series, and that really focused on suicide risk formulation and what we could do to help keep individuals safe, and incorporated something entitled safety planning, which is something we do for individuals who do have experience with mental health situations, and we don't want them to be in a crisis and not know where to go or what to do to keep themselves safe. So we incorporated that as a large part of the training in 2019.
You mentioned that the suicide rate is, 10 nationally and then 11 in the Chicago area in Illinois, but yet people are really hesitant to still talk about suicide and don't really know a lot about, suicide prevention. So I know that you participated in a forum just last week that was well received in the community. And what were some of the things that you guys discussed at that forum?
Yeah, so the forum was actually sponsored by a city councilman, John Crewman, and Dawn Dessart, who's a DuPage County board member. And they, same thing, really wanted to increase awareness and focus on suicide. We had about 35 individuals who attended from the community. Many of them were parents. And we had a large number of youth in the room, which was actually very interesting to see. We had representatives from the LGBT community who were there as well, and generally spanned all age groups. And I think the questions people really want to know is, why is this happening? What can we do to help prevent it? And when we see somebody who's really in crisis or distress, how do we take action to keep them safe? So it was a very exchanging, informative interaction that we had that evening.
That's kind of the premise behind mental health first aid is like if you see something, say something, and then get a trusted professional to kind of assist with that individual and just kind of noticing. So throughout the segment, we're going to kind of be talking about protective factors and risk factors and what we can do to be helpful when people are in crisis. So we can probably just start talking about some of that stuff right now. Specifically, when we teach mental health first aid in the community, there are a lot of questions regarding the risk factors. But on the other side, there's also protective factors. So maybe we'll start out with kind of some of the risk factors that you could kind of pinpoint as being.
Well, I think you bring up a really good point, Trina. It's a balance. So it's how do we strengthen those protective factors and reduce those risk factors? Because the protective factors is where I always like to start. That's what keeps people safe. And it really helps individuals cope in times of stress. And so protective factors are generally broken into 2 categories. There's the internal protective factors and then external protective factors. So internal protective factors are the things that are within us. So my coping skills, my ability to problem solve, my ability to deal and manage stress that I have. What resources do I have? Am I a faith-based person? Do I belong to other clubs or groups? Things that make me feel connected and safe with others. And then on the external factor side, some of those actually do cross over, for example, religion. So individuals who are faith-based may also be a part of a community church or a community faith-based group, and so that's a place where they can go for support as well. Other things that are external protective factors are the wonderful Naperville community that we live in. We have access to not only physical health care, but mental health care as well. The other things that we have access to are a community of individuals who really do care about their colleagues and their fellow in the community. And then the other thing that protective factors I always like to keep in mind as well is, particularly in our seniors and, pets. Things that make us have a sense of responsibility. Things that if I weren't there to care for that person or that individual or my pet, who would take care of them? So protective factors really are something we want to strengthen and enhance whenever we can. On the flip side of that are the risk factors. So what are the things that really make individuals more prone or at risk for suicide? Two of the most important ones are a family history of suicide and previous suicide attempts. And so we always know when we see patients at Linden Oaks, if either of those are shared with us, we automatically have a greater focus, on suicide prevention with that individual. Other risk factors are certainly substance abuse, relationship problems. About 42% of suicides get attributed to issues around relationship problems. Certainly never one thing, right? Substance abuse is a large percentage because of the impulsivity particularly that we see, or binging in individuals. Financial and job stress are other things that contribute. Sustained stress, so bullying, poverty, homelessness. These are things that really would make an individual more prone and more at risk.
So we talk a lot about protective factors in youth mental health first aid.
That's great.
And then when I teach adult, I always bring it up because people say, well, does this happen when individuals are younger? So we talk about the protective factors, and then we dive into the risk factors, and people take for granted those things that a lot of people grow up with, those, routines that people have, or those consistency in an individual's life. And that consistency looks different for a lot of people. I always say, mine was having dinner every night with my family, right? But that could be different for another person, as long as it's a consistent practice that an individual, specifically a youth, can rely on as something that they know that they can hang their hat on, that they're going to have every day, and they're going to have that support of that parent calling them at 6 o'clock at night to check on them, or checking in with them before they leave work that day. So on the flip side, I say individual can have all of those risk factors and still be okay, because they have a lot of protective factors in place as well. So it's a delicate balance between the two, and kind of helping people that want to be helpful to people who are struggling with some mental illness and some suicidal ideation, and just being able to kind of recognize those signs.
Well, and I think the other piece that goes with protective factors, and it's what you were alluding to, is values. And so values play a really important role. So what I heard you saying was family is something that you value, that connectedness that you have. And we know connectedness is a protective factor, both internally and externally. Values are different for each of us. So for you, as you said, it may be your family. For me, it could be my golf group that I'm with, and those individuals. For another, it could be an organization that they contribute or do work to because they want that sense of belonging. Job, for many people, is something they value. Music, art. So for each of us, it looks differently, but again, they work with those protective factors, and they help us all stay safe. I think about clubs and things in school. It's a really important thing to try to connect kids in particular with something that they can do. And so, those clubs, those teams, those after-school sports and activities they're involved in really can be a great asset.
Okay. We're going to talk more about that when we come back. We'll just take a short break, and we'll be back in a minute.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Okay, welcome back to Mental Health First Aid. Again, we are joined by Kelly Bryant, and we're talking about suicide awareness and how to take action to prevent suicide in our community. We ended the first segment with talking about protective and risk factors. And I indicated that, you could have all the risk factors in the gamut of risk factors and still not develop a mental health disorder. And you could have all the protective factors and develop it. So it's a combination of the two. But in your experience, what have you kind of noticed in the community?
I think one thing that's important to remember or keep in mind is about 3/4 of individuals who die by suicide actually have seen their primary care provider within the past 30 days. And so not only do we need to be educating the community, we need to ensure that the primary care providers out there, know what to focus in on as well. Suicide rates do increase with age, and so while we often talk about the youth, it's now known that it's the second leading cause of death in 10 to 14-year-olds. And that's typically what we hear about is the younger adult, but actually the rate continues to increase with age. And as our demographics change across our country, that's something we really do need to be concerned about. The highest risk group right now that we're seeing is the 85+ population. And so previously we talked about protective factors and what are the things that keep people safe and what do people value. And so if you think of an older adult, many of the things in their life that they had start to change. And so that's a group that we really do need to target and focus on. The other area of concern that we've seen is something referred to as predicament suicide. And this is when something happens that is just so egregious or so difficult or so stressful to an individual that they feel at that point in time that they have no other choice or no other option but to die by suicide. And so that's something we really do need to have a greater focus on. And the other one is chronic suicide, chronic suicidality in an individual to be particular. Individuals who have chronic thoughts of suicide, and there are many individuals across our country who do, are also at very high risk because it often takes not much to move them from that unsafe to that, or excuse me, from that safe to that unsafe place that we need to be concerned about. The other thing we've tried to do a lot of education around is language. And so we hear people say they committed suicide. We don't want people to commit to suicide. We want people to commit to life. We want people to commit to making good choices. We want people to commit to seeking help. So we want to be very aware of what we say. We should use terms like someone died by suicide or it was a death by suicide. You can actually even use it as a verb and say someone suicided. But we really don't want to focus on those other labels that we use because it places judgment on an individual. Because let's think about it. If someone says, well, they had a failed suicide attempt or they were unsuccessful, gosh, here's someone who's already not feeling too good about themselves. And now what we've done is we've made them even think, oh gosh, I can't even do that. What can I do right? So awareness of language is very important, and I think the media in particular has been very helpful with us over the past several years. We've seen less and less focus on sensationalizing some of the deaths by suicide that have occurred. We've seen a greater focus on sort of the mental health components and using that as an opportunity for education. So I'm really pleased to see that.
We do talk about that in mental health first aid is changing the language. And people at first, they kind of struggle with understanding why. And then you try to, you explain it, when you think about commit, what is that? People think of commit a crime, commit adultery, commit a sin. This is not something that, and it's hard for people to change the language. And when you hear it in, because you're in the mental health field, I teach mental health first aid. When you hear it, it makes you cringe a little bit. It kind of hits you a little bit harder than when you're thinking about that person, and you want to show grace and compassion to the individual as well as the family who may have lost a loved one to suicide. I do want to go back to the part that you talked about, the older adults, because we talk about that in youth mental health first aid, and we have this specific exercise that we do that we says the median age of onset, and we ask specifically about depression. And I say don't forget about our geriatric population when you're thinking about that number, because people always tend to go to the 17, 18, 19 age group, when in fact it's in the 20s, because you may have an individual who has never struggled with depression their entire life, and now they're an older adult, and like you mentioned, their protective factors of their loved ones passing away. They're no longer in the mental, they're no longer in the physical shape that they used to be, and they don't have the supportive factors that they have, and it changes, and now they're depressed and they're struggling with, not having those factors in place.
Yeah.
So it's interesting that you brought that up.
Well, I think white men in particular, 55 and older, is another particularly high age risk group that we look at. And if you think about some of those protective factors and the loss of them, you can see why that may come into play. I'm glad you're talking about that in youth first aid because, many of those young adults are with their grandparents. And so they might be identifying some things that are of concern. So that's really, good news to hear.
I really enjoy teaching both curriculums. Specifically, I have a young person, so I feel like it's opened up my eyes to a lot of different things, and just to the different stigma that's surrounding mental health as well as suicide, and just really understanding what people are struggling with. And so we can kind of talk a little bit about the warning signs and what people should look for in their loved ones or individuals that they work with or people that they're close to or see on a daily basis. What kind of warning signs would people look for?
Well, we look at things that people hear, things that people see, and then mood or behavior changes. And so I think the mood changes are probably the easiest things for us to tap into. So someone who's normally happy is sad, someone is irritable that's not normally irritable, someone's anxiety level seems to be a little bit more, but something is just different about that person. And so it kind of makes us wonder what's going on. And then we look at the other things. So what might we see with that individual? They might be more withdrawn. Maybe they're not attending activities or programs or things they were participating in the community. They might be giving things away to individuals. We might actually see some signs of people saying goodbye. I've also heard in cases where on individuals' Facebook pages or the internet, they've actually deleted some of their, their posts, their messages, and so, we really do want to look for that. And then the last thing we want to focus on is what did we hear? So people might say things like, this is no point, it's hopeless, I don't serve a purpose anymore, I'm going to end my life. I wish I could just go to sleep and never wake up. So when we start to hear those things, those warning signs, we get really concerned because, warning signs are imminent. It means somebody is at imminent risk. So earlier we talked about the risk factors, but when we begin to see those warning signs, we really need to be very attuned to what's going on now. And we need to stop and we need to start to take action.
And also one of the risk factors that we talk about in the warning signs in mental health first aid is, let's say somebody that you're close to has been down deep and they just seem to be like in the shallows of a depression. And then tomorrow you see them and they're up here, right? And people go, well, oh, John's great. John must be great. So let's talk about that after break and what that looks like for individuals who's tried to be helpful. Thank you. We'll be taking a break for just a couple seconds. Thank you.
Mommy.
Yeehaw!
Llama al 1-888-971-2013 y obtén información para cuidar mejor a quien cuidó de ti.
Welcome back to Mental Health First Aid. We're joined again by Kelly Bryant. We're talking about suicide prevention, and specifically when we ended the last segment, we were talking about kind of some warning signs, and we talked about, or I mentioned, a dramatic change in mood and what that would look for, what somebody would look for when identifying that.
So, it's interesting. People are often hesitant to ask about suicide because one of the myths or misconceptions out there is if you ask somebody if they're thinking about suicide, you'll actually put the idea in their head. And that's a myth. It's well known. And actually what you might be doing is saving somebody's life by asking. So that's a really important thing we need to keep in mind. And the other thing is minimizing when someone says, oh, I'm going to die by suicide, or they may say commit suicide. or I'm going to jump off the bridge. We take all threats of suicide seriously because we never know when that really may be the case. This is where education, I think, continues to be really, really important. And why don't people want to take that next step? Well, there's stigma associated with mental illness. There's the fear of not knowing what to do if somebody says that they are contemplating or have thoughts of death by suicide. And then the other concern is if somebody does do that, what do you do in that case? And so we spend a lot of time, and I don't know if you do this in mental health first aid, but we talk a lot about when you see somebody who you're thinking is not safe, the first thing we do is we stay with that individual. We never leave them alone. And we might ask them some questions, and the questions we want to ask them are to get a little bit more information, and we use questions in a way that are I statements. So things that I might say to you could be, I'm concerned about you. I've noticed a change in your behavior. I've noticed that you're a little bit more irritable than you normally have been. I care about you. Is there something happening right now? Is there something going on that I can help you with?
We do talk a lot about that and changing the dialogue of you. I think that it comes across as accusatory when you're talking to individuals, or you haven't been arriving to work on time. You seem very moody. It has a totally different inflection when you say I, because it comes from a place of concern and compassion.
Absolutely.
And so we try to change the dialogue. And I know that in a relationship that I have with a loved one, when I changed the dialogue, the conversation changed. And it allowed the individual who was struggling to kind of open up. It wasn't about, you haven't done this, you haven't done this. It's like, I've noticed, I'm concerned, I love you, how can I be helpful? So it's really about changing the dialogue. So if somebody is hesitant to ask somebody that question that nobody wants to ask, it's probably because they're afraid that the answer might be yes. How would an individual ask the question if somebody was thinking of harming themselves?
I think a simple thing to say is, I'm worried about you. I'm concerned about your safety. In many families in particular, one of the things you want to talk about is if I have a sense that you're not safe, I'm going to need to reach out and get some help. We have wonderful resources here in our community. We've got text lines, we've got phone lines. Often we find out through our young adults who come into our organization that the kids actually text each other. And a lot of times parents or family members become notified because they've been notified by a friend of that individual.
Right.
So it's really taking that next step to get help. And you know, I always like to think about mental health and mental wellness are on a continuum. And individuals who are really in distress, because suicide is about pain. It's real pain. It's often even been called psych ache. And so an individual moves on this continuum back and forth. And so we want to try to get to that individual at a point in time where we can really keep them in a safe place. One thing we do is we do something known as safety planning. So a safety planning is a great thing to use either for yourself or someone that you know of is struggling with mental health issues. It identifies what are the things that I begin to feel when I'm feeling unsafe. What are those changes in my mood or my behavior that I might begin to notice? What are things I could start to do to enhance some of my coping skills or protective factors? So that could be listening to music, that could be some other distractions that an individual could use, might be reaching out to a friend for help, but what could they do to keep themselves safe? If none of those resources are working, who can I call? What are those crisis response numbers that I can have immediately available for me? Because you want this crisis response plan or the safety plan to be in place when you're not in the crisis, right? You want it ready to move forward when you need it. And you also want to make sure that individuals in your family or your friends who you might be calling on for help, excuse me, sorry.
Lots of talking.
Less talking. Who you might be calling on to help you are aware that you're going to be reaching out to them and calling them. So that actual safety plan might be something that you give them a copy of as well.
Right. When we teach mental health first aid, we always we make sure we have the suicide prevention number, which we will have at the end of the segment on our screen. But people need to have that in their phone. I know that when my loved one was struggling, I said, if you're ever feeling like this and you can't get a hold of me, you need to call this number or you need to turn to the person next to you and say, I'm thinking of harming myself. You know, it's our mission to kind of keep people safe and to be there to be able to support whoever needs support. What would be, I know we talked a little bit about education. And you talked about the nurses during our break, but also the primary care physicians, and people will often present to the primary care physicians. And I know in the different medical groups, those questions are being asked at the beginning of, I mean, I know when I went for my physical, the dialogue had changed. It wasn't about your blood pressure at the first couple of questions. It was about how you were feeling in your mental state. And you're having that discussion with the nurse so that if you are at any risk, you're connected, and that those providers can connect you to resources in the community that could be helpful. Doesn't need you go to the emergency room or you need to see a psychiatrist. Maybe it's just that you need somebody to talk to and that you can turn to.
Yeah. Well, I'm glad you mentioned nurses. You know, nurses play a key role in, you know, keeping our community safe. The American Psychiatric Nurses Association several years ago launched a curriculum entitled Competency-Based Training in Suicide Prevention. And we're fortunate here in Illinois, we have 3 trained facilitators who teach locally here in Illinois, and then I also teach on a national level across the country. And it's really to help nurses play a more active role because, as you said, nurses are in many of these care settings. We also know that nurses are one of the most trusted professions. And so part of that ability to ask and to get that information from an individual is to have that rapport and that trusting relationship. So I'm very proud that, you know, Linden Oaks jumped right on this, and, you know, we probably have one of the largest number of trained nurses, you know, really in the state at this point in time. The nurses we trained were not just Linden Oaks nurses, though. We trained triage nurses in the physician office settings, as you alluded to. We trained school nurses in our local school districts, 203 and 204. We actually had parish nurses who came and were trained. We actually had physicians and other providers who came to the training as well. So this is something that we see as a great opportunity to continue that dialogue with professionals about what they can do to really play an active role, not only with the patient, but with the families and the support members of those individuals when they come in for care and service.
It's interesting that you brought up the school nurses because a lot of times young people will present at the nurse's office 1, 2, 3 times a week with something going on. And it might not be physical, but they're in some type of pain and they're seeking out a trusted individual. So nurses are really, you know, I have a bunch of nurses in my back pocket that are my good friends, and they're the people I call when I have a question, and they're really knowledgeable and they're compassionate as part of their trade, and they're really good resources for us.
So, you know, when I think of suicide prevention, everybody plays a role. So the community plays a role. The community members play a role. The mental health professionals play a very active role. And as we talked about a little bit earlier, so do all of the primary care practices that are out there, and pediatric offices. So, you know, sometimes when we think of the primary care office, we don't think about pediatricians, but that's a really important group for us to focus on, especially when we think about this, you know, second leading cause of death in 10 to 14-year-olds. The other thing we have done across the Edward Elmhurst Health System is we have implemented suicide risk screening using a tool called the Columbia Suicide Severity Rating Scale. This is an evidence-based tool. We ask every individual who comes into any of our emergency or urgent care centers a series of questions to determine if they are at high risk. When they are in the inpatient setting, whether that's at Linden Oaks or one of the acute care hospitals, we ask those same questions. If they're in the acute care hospitals and an individual is identified to be at risk, then we're able to get psychiatric support services to that individual. And then, of course, at Linden Oaks, for our team members, when we identify one of those patients, we are then able to really enhance some of that safety planning that I talked about a little bit earlier and really helping that individual so that when they are in crisis, they can keep themselves safe.
Okay. Very fascinating. We can talk probably for hours on the subject. We have to end this segment, but I will definitely have you back. It's all about keeping our people safe.
Absolutely.
Keeping our loved ones safe, keeping our community safe. And at the end of this segment, we're going to have the numbers for you to call of the National Suicide Prevention Hotline, as well as the text number. Please share this with your loved ones. Store it in your phone because we can all be helpful in suicide prevention. Take care.